Well, it seems the National Coronavirus Command Council is currently meeting at the moment. On the agenda is whether or not the vaccine rollout should be open to everyone over the age of 18. In other words, all adults. Yesterday, the Health Minister, Dr. Joe Pagler, said he believed all adults should be allowed to go and get a vaccine. Meanwhile, the Gauteng Health Department today asking people to get vaccinated. We've seen the number of people getting vaccinated on a daily basis starting to slow. The chair of the Ministerial Advisory Committee on Vaccines, or co-chair, I should say, is Professor Schoub. Kwara Kekana is the spokesperson for the Department of the Gauteng Health Department. Let me get that right. Good afternoon to you both, and thank you for your time. Kwara, let me start with you. What are you trying to do as a province to get more people to get a vaccine?
A very good afternoon to you, Stephen. Good afternoon to you, Prof, as well as the viewers at home. I think, the viewers at home and yourself, Stephen, have probably been interacting with some of the efforts by the Gauteng provincial government, in particular the outreach programs that I think were concentrated in the Tshwane district last week, led by the Premier David Makhura and the Health MEC, Dr. Matemba Mokgethi. This afternoon as well, there were about 3 sites that the provincial government visited. In particular, the focus has been, hard to reach areas such as farming communities, but also we're also focusing on having pop-up sites, as well as drive-throughs. Some of the innovations that we're putting in place and working very closely with some of the social partners. And one of the things that we're also doing tomorrow, I think tomorrow, Wednesday, I believe, is to also establish pop-up vaccination sites in some of the transport modes, in particular the Bara taxi rank. You'd understand it's one of the busiest, transport modes in the Johannesburg district in particular. So there's going to be activities there as well. And we're really hoping that we can really take the vaccines to where the people are and make it a bit more easier for people to access the vaccine. Of course, our clinics, our CHCs, our hospitals as well, and some of the drive-through vaccination sites that have been set up through our social partners as well, continue to operate, Stephen, and are accepting walk-ins whether or not people have registered on the electronic vaccination data system.
Professor Schoub, the idea of lowering the age at which people can get a vaccine, do you think that'll make a difference? Is that going to get a lot more people vaccinated more quickly?
Yes, good afternoon, Stephen. Good afternoon, Kwara. Yes, I think it will. I think that there's probably a sort of a kind of a bottleneck behind that age group, which will kind of get the people coming in. But I think it's going to serve 2 purposes. First of all, it's going to increase the vaccine coverage, clearly. It's going to be quite a reasonably large population which should now be eligible for vaccination. But I think also importantly, if young people do go and they kind of influence the older folk, and I know that there is concern because in the older age groups, particularly the 60 plus, we haven't got adequate coverage. And I think the younger folk coming in can influence their parents or their grandparents, because I think there's a lot of kind of nervousness, maybe to some extent suspicion about vaccination. And I think if other people who haven't been vaccinated, who have been eligible up to now, but haven't taken advantage of vaccination, can see that that being vaccinated is not a major issue. It's a fairly benign thing with a tremendously great beneficial benefit to them and to the community. So I think it's a good thing.
In a way, there's an issue around communication, Professor. And in fact, Professor Francois Venter, I'm sure you know him at Wits University, suggested this morning, I think he was being quite critical of government when he said this. He said that whenever the number of people getting vaccinated on a daily basis starts to slow, government lowers the age of people who can get vaccines. Do we have a bigger, maybe, communications problem, Professor?
Look, I think at the heart of all of this is communication. But, in a way, it's not fair to kind of lay all the kind of criticism and blame on the government. I think the communities themselves also have a responsibility, whether it is faith-based communities, whether it's cultural communities, whether it's sporting communities. I think everybody can kind of really put shoulder to the wheel to get people to come to be vaccinated. It's not just the government's responsibility. So, it's easy to kind of blame the government, but I think the government has provided the wherewithal. The government is providing some of the communication resources, but I think the community itself needs to also take responsibility for communication.
Kwara, in a way, Gauteng is key to this. It was the center of the 3rd wave of the virus. As the province of Gauteng, do you think national government has dropped the ball here? We all know why this is. This is related perhaps to the digital vibe scandal in the former health minister, Dr. William Kize. I won't push you to comment on that, but would you prefer, as Gauteng Health, the national government, to be communicating more?
Look, I think that, the way in which we're approaching COVID-19 and the response to the pandemic, Prof is right that, it's not solely the responsibility of government. It requires a collective approach in the way in which we communicate and also just, mount the fight against the pandemic. And the COVID-19 vaccination program becomes quite important. And in Gauteng, one of the things that we've seen that are quite instrumental is also the increasing involvement of social partners. And in particular, some of these pop-up vaccinations that we're seeing are really spearheaded by other social partners outside of government that are saying, we want to come to the party, how can we help and how can we support government in ensuring that more people get vaccinated? And of course, the conversation in Gauteng is going to be extending also to, faith-based organizations as well, to then say, in particular areas, how can we have a conversation with your congregants? How can we have a conversation with your constituents as well? Those that might have, anxieties and uncertainties in terms of getting vaccinated. How can we close that gap and ensure that people get the correct information? And again, Prof is right with regards to the cohort that's coming in. That's a strong number that's coming in there. And there's a potential to also influence other groups that might be, discouraged or maybe having hesitancy towards getting a vaccine. And you can almost sense, and that's also my cohort as well, so you can sense the excitement around getting the vaccine around that age group. And because I think it becomes quite important that that group then comes in and push the numbers up and hopefully really influences, the rest of, family members, your household that might have, members of the household that might have concerns as well, and influence them to also go get their jab.
Kwara, Gauteng, in a way, is more vulnerable than other provinces to the virus. It's more densely populated, it has a higher number of people, people live more closely together. But that also means it should be easier to vaccinate against the virus because it's more densely populated and people live more closely together. And yet, as I understand it, Limpopo and I think the Eastern Cape are actually doing percentage-wise better than Gauteng. Why are you falling behind?
It's quite unfortunate, you're right, Stephen, with regards to the fact that, Gauteng has got, it's densely populated, the province with the largest population in the country. So we're really hoping that, that over 4 million cohort that's coming in, as and when the national government will communicate, to open for that cohort, will then come in and then push those numbers as well and continue to influence, other groups in various households. I think we can be doing more, and I think that's why, the emphasis has become quite strong within the provincial government and through our principals to say that, there is a need to also, go to various areas and really ramp up the vaccination, take the vaccine to where people are. And I think one of for me, farming communities become quite important in remote areas. Also, the pop-up sites in areas such as transport modes where people are moving in and out on a daily basis, taxi ranks, bus stops, and so on, that becomes quite important. But I do think that, we can't, stop emphasizing how important it is for people to come out to get their vaccine. And the numbers in Gauteng could definitely be way better than that we're seeing now. And the sentiment that the Premier, shared this afternoon when we were in Loli in the far south of Johannesburg as well.
Professor Schoub, one of the things about this is that we have had to do this in the past. Now, for most of us, and certainly people of my generation, and let me just say I'm entering early middle age, if I can call it that, we were vaccinated as children. But in the past, I'm talking about the 1950s, adults had to be vaccinated against certain diseases. Are there lessons from that period, or, have we just forgotten how to vaccinate adults?
You make a very good point, Stephen. Actually, if you really analyze it, this is unique, that we've never had a kind of a nationwide, and I suppose global nationwide, if you can call it that, rollout of vaccination amongst adults. We've always focused on vaccinating children in terms of universal immunization. So I think even though we did vaccinate adults, I think it was never on this kind of extent that we're rolling out vaccine to all adults in a mass vaccination campaign or program. So I think internationally everybody's in a learning curve, as we are as well. And this is novel. This is in a way a novel experience. I think we will learn a lot from this. I think we should have learned a lot from previously, but I don't think that we can learn too much from what happened before, because I think there are quite a significant differences. This is almost unique now.
Well, in some ways, for example, in the United States, they're having the same problem. They've been vaccinating longer than we have. In the state of Mississippi, something like 39% of people have been partially vaccinated. Less than half. Yeah. This is a state in a country which discovered and produced the first vaccine. Professor, this shows you how difficult this can be.
Absolutely. No, in fact, where we're seeing the kind of steep uprising of the figures in many European countries, in the United States, it's largely that proportion who have not been vaccinated and obviously are remaining to be vulnerable to the virus.
Well, Professor Barry Schoub, thank you very much indeed. Kwara, Kekana, I do appreciate the time. Thank you, Spokesperson, the Gauteng Health Department.